All right, so we're gonna wait for, I'm recording. We're live on Facebook. I'm gonna go on my page on my phone so I could see the comments when we get an audience that they start coming in and then they start watching it. Oops, wrong one. And if they want to ask questions, you could do it too, Melissa. If you want, just get your phone and go to my page and look for the live stream and just click on it, but lower the volume. And then you could.
No, that's okay.
You're like, no, that's all right. That's too much.
Well, I don't want to mess anything up. It's working now.
Okay, there we go. All right, so I brought it down in case people ask any questions. So usually I could see, I don't know when it's gonna pop up. I guess you gotta have so many people viewing before it pops up. So
okay.
Yeah, we're gonna get a few. Yeah, so we'll wait for some more people to join us so they could hear your, oh my goodness, your story. It's just, I was so happy when you told us the news. But before we get started, just wanted to let you guys know that we have lost two amazing women, I think in a matter of a day or two. Yes,
I saw that.
Yesterday was Terry. I met Terry. Oh God, when did I meet Terry? Oh my God, I can't even remember. But I met Terry, but I hung out with her for a little bit last year at the Hope Summit. And I think we went, I gotta look for the video. We went Facebook Live. Remember when you joined and Greta joined when I did Facebook Live? Okay, yeah, Terry was the first one. So it was Terry, then, and she shared a little bit of her story. And then she was like kind of nervous to be in the camera or whatever, in the phone or, Facebook Live. Then she left and then you came and I think Greta came. So I know I have the video.
Oh, yes.
Remember that? Yes.
I do remember that.
Terry was the first one.
Oh. That seems sudden. I mean.
Yes.
Did anybody know that she was not doing well?
No, I didn't even know. So Kimberly Adams Butchmere. I'm sorry if I said your last name wrong, Kimberly. She said, hi, Melissa.
Hi, Kimberly.
So then Terry, and then today I got I guess Shauna. She would always tune into my Facebook Live and comment, yeah. And so I didn't realize that she was that bad either. And I guess I'm not sure if she passed last night or this morning. So my condolences to Terry and Shauna's family. I was very hard. I pretty much hold my tears back. I don't cry, but with the mess going on with the COVID-19 and then them passing away and just this, I finally broke down today in the kitchen. I was drinking my coffee. I finally broke down and just let it all out. And it felt good to cry and let it out.
Yeah, it's just like so much to process. And
Yes, so much to process. Hi, everyone that's watching. Thank you guys for tuning in. This is Melissa. She has an amazing story. This is Melissa's interview part 2. Well, actually, it will be part 3. But
if you count the summit.
Yeah. I mean, we won't count the summit. She just jumped in to say hi and speak.
Yeah.
Officially, this is part 2. I interviewed Melissa last year. I forgot what month, and she came on. And she was reminding me of the technical difficulties we had, and I told her doing it through Zoom and streaming it on Facebook is so much better than when it was Facebook Live and I'm trying to get someone on. I'm like, no, it's much better. So Melissa, this is her part 2 interview, and Melissa is a 14 years, listen guys, 14-year survivor. And she's been through a few clinical trials. This woman has been through hell and back, okay? And she's gonna share her amazing story. And I'm getting some viewers. I need you to share this video. I need you to share it. I need you to start a watch party. I don't care what you do. I want people to hear her story, because it doesn't matter if it's 5 months, if it's 1 year, if it's 5 years, if it's 13 years, if it's 20 years, I don't care. There is hope when it comes to lung cancer. There is hope. All you got to do is have some faith. You got to be positive. You got to be strong-minded. You got to surround yourself with positive energy. I'm telling you, there is hope. If Melissa, 14 years, is going to right now give us some amazing news, there is hope for all of us. So please share, invite people, start a watch party. I don't care what you do. People need to hear her story. She had reached out to me and I was kind of booked, and she wanted to come on and share her story with us about, the news that she's going to send. I don't want to ruin it. And I told her, okay, yes. And I'm like, I'm booked. I'm like, oh my God, I got to get her in somehow. Well, my interviewer for tonight had messaged me a couple of days ago and said, I reminded her, she said she wasn't feeling well, yada, yada. So I was like, I've been kind of uneasy and kind of just like, I have that blah mood where because of all this pandemic and shut in and all that. And I'm in the city in Indiana, so we're shut in. And I just was like, if it happens, if it doesn't. But then Melissa's name came across. So to me, that was God telling me, message Melissa. And it was today because I really got into deep praying and feeling really not scared or nervous, but a little anxious, a little uneasy. So I just got into my room, quiet time, meditating and with deep prayer. And then Melissa came across and then I messaged her, you want to go out tonight? Do part two. So we're here. So, I thank God for that, for, somewhat telling me what to do. So you guide my steps. So please, again, share, invite, start a watch party. Everyone needs to hear Melissa's story. So I'm going to let Melissa take it over. If you have any questions for Melissa, I have my phone here. Okay. And I can see the comments because I can't see them here because we're on Zoom, but I can see the comments on my phone. So if you have any questions for Melissa, just make sure you comment. I would read her the questions, she would answer. All right. And again, share, watch party, invite. I don't care what you do. Everyone needs to hear her story. So Melissa, take it away. Give us the good news.
Well, the last time we spoke, things were a lot different. I was undergoing my 6th clinical trial. I'm still on it, actually. But since I talked to you last, I guess I'll start here and then kind of go catch up. Since I spoke with you last, I had 2 stubborn tumors in my liver. That's where my cancer metastasized to. So my doctor had me have a liver ablation done in September. So they went in and they scraped those tumors out. And so I've been NED ever since. I continue on my, I know, it just blows my mind because most of you know that I was diagnosed in 2005, and I've been living with lung cancer ever since. Now, when I was diagnosed at stage 2A, had the lobectomy, underwent chemo, and a couple years after is when the metastasis happened. So for the greater part of 14 years, I've been living under some kind of therapy. I've been on every chemotherapy you can imagine. And I want to take this opportunity also to share that if you possibly can, see a specialist. If you possibly can, see a lung cancer specialist. As I talk to people across the country, it really distresses me and it happens so many times. I'm speaking, and I'm sure a lot of you have had the same thing happen. When you speak to somebody and you ask them about if they've had extensive, comprehensive biomarker testing, and no, they haven't, or their doctor doesn't think they need it. So I was very fortunate in that I landed in good hands. It's been a really rough at times journey. When I first had my first recurrence back in 2009, I was put on a pretty harsh protocol or therapy, combination of drugs, to where I lost a ton of weight. I ended up in the hospital with failure to thrive, and they actually thought I was going to die. And my son nursed me through that time of my life with making me protein shakes and forcing me to drink them and all that. And then the second life-threatening situation I found myself in was I was at school. I'm, of course, an orchestra teacher, or was, and it was the last day of school before break. So I was doing my big show with the chorus and the orchestra. I'm running around from place to place. And all of a sudden, I didn't feel well. And the next thing I know, I collapsed.
Oh.
Well, I was in a coma. I was in ICU. I was in on a ventilator. I had suffered a pericardial fistula that was caused by earlier radiation to a section of my liver that was near my heart. So it's a very serious. It's very, very serious, and my family was told I probably wouldn't make it through the night. So that was in 2012. But I still went back to work after that, and I worked. I had a wonderful principal. Obviously, had a couple times where I was out for an extended period of time. But when I had progression again in 2015, I knew I just couldn't do it anymore, work and be on treatments. So that's when I made my decision to retire. But I have to credit clinical trials for me being here. And there's a lot of us that say that today. As I said, for me, the sixth time was the charm.
Yes.
And I've pretty much I've lived the research in a sense, because anytime something came out, it's like, well, let's try this on Melissa and see what happens. And that's how it's gone. My mutation was actually discovered in 2012, but it wasn't until 2016 that a targeted therapy became available for it. So.
And what's your mutation again, Melissa?
My mutation is the RET mutation.
Okay,
it's like
right.
ROS1. It's like 1 to 2% of lung cancer patients have this particular mutation. So.
And for those of you that don't know what NED stands for, I'm pretty sure a lot of you do, but those that are not lung cancer patients or survivors and don't know what NED is, no evidence of disease. We don't say cancer-free. We don't say remission. We just say right now, at the moment, we are no evidence of disease. Just wanted to clear that up. Because I know I get a lot of people that ask me, oh, are you in remission? Are you cancer-free? I tell them no evidence of disease. But in my mind, because I'm a believer, I'm saying, oh yeah, I'm cancer-free. I don't like remission. I'm cancer-free in Jesus' name. But I do tell them no evidence of disease. So just so you guys know that. Right.
It's a much better clarification.
Yes.
And me personally, I always had trouble with the survivor versus the living with lung cancer, because we all know people that beat lung cancer. Well, I hate to say that, but they've been survived. They've been survivors in that they've never had to come back after their initial lobectomy or whatever.
Right.
But I lived with this for 14 years. No. It's not like I was I hate to say beat it, but it's not like I was NED for all these 14 years.
Right. Yeah, you lived with it and you got through, and it made you the strong woman that you are today, Melissa.
Uh,
You are.
yeah.
You've been doing this much longer than I have. And, believe it or not, newly diagnosed, a lot of people, they look up to you because you're a, long-term survivor. I mean, 4
Yeah.
years. Now, I know Terry here in Chicago, what is she, 15 plus, maybe 16 now? And knock on wood, thank you, Lord, hers has never came back.
Well, see, that's what I'm saying. Bless
Yeah,
her heart, you know.
she had one lung removed, and Bobby also, Roberta, we call her Bobby. She was almost maybe as long as you were, maybe a little bit longer, and they did find a very small spot, and she had it surgically removed, and she was hers came back. They did the God. Why can't I think to the biomarker? And she's KRAS.
Oh.
Yeah, so she joined a small little KRAS group. But yeah, I mean, I know what you mean. I mean, but like I tell people, and like I was telling you earlier before we went live, that you have to stay positive. You have to surround yourself with positive energy. You have to speak whatever you want in life. You have to speak it into existence. Don't say, oh, well, let's see how long it lasts. No, no, you just say it's not coming back. That's what I've been saying that. Mine's came back, but it didn't stop me from not saying it. You understand what I'm saying?
No, I do understand what you're saying. And since work was my saving grace, because I went to school, I taught middle school. They keep you on your toes, and I loved every minute of it. But I just didn't think about it. It got to the point, of course, initially you feel like you've been hit by a freight train. So you go through the denial and the anger and all that.
Yeah.
And then, I've come to acceptance a long time ago. I don't even, it doesn't even enter my mind anymore.
That's good. Yeah. Me either. Mine's, okay, so 2 days before Thanksgiving, you had brain mets, 2 small spots. Yeah, I was kind of down when I found out. And then I took off to Florida for a week, and I got stuck out there because we had a snowstorm, which was fine with me. Then I came back and then really started just going to church a lot, and that helped me. And now I don't even think about it. I don't even talk about it. People ask me, oh, how are you doing? I go, I'm fine. Oh, but I'm like, oh, I forgot about that. I'm fine. I'm great. I mean, really, I got to that point where I just like, it's there. So what? I'm going to keep living life. I'm going to keep doing what I do. And I don't talk about it. I don't bring it up, nothing anymore. So
right.
I go next month. Hey, whatever it is, it's in God's hands. I trust him.
That's right.
And yeah, sometimes if for you, years, you've done that for 14 years. But now that after 14 years, because of this last number 6 clinical trial, and you became Ned, is absolutely amazing.
Oh, I know.
And a blessing.
It's crazy.
And I congratulate you, and I'm so happy for you, Melissa. And I thank God for you. And I tell people, sometimes he allows things to happen. There's a reason, there's a purpose for it. And you're just and two, 14 years you've been at this, and also you've been an advocate. I know you talked about it last time, but talk about it, your advocacy work, but more the current. So currently now, what are you doing advocacy wise? And oh God, I just lost my train of thought. I was going to ask you something. So currently now, what's your advocacy work? What are you more focusing on now that this clinical trial worked for you in your NED? So are you doing now more advocacy work towards clinical trial, or what is it?
Okay. Well, it's between the clinical trials, which I highly recommend to anybody.
Mm-hmm.
People are afraid. You shouldn't be afraid, especially when you have no other options. What have you got to lose? So it's clinical trials, and it's comprehensive biomarker testing. Also, I started the group, the Renegades.
Yes.
How we're doing all these groups. So
Yes.
that's with me. I sit on a panel for Bristol Myers Squibb, and they're working on a pilot study that I'm involved with. I also am on a panel with GlaxoSmithKline, and we're working on clinical trials as far as the language and writing up the protocols so they make sense, if you know what I mean.
Yes.
So that, and I just was in Atlanta right before this whole craziness started with the smoking
round table?
summit.
Was
yeah,
it
the round table. Yeah, the round tables.
Yeah, there you go, tables. Yeah, with the S.
So, and what was really nice about that was we, and when I say we, I mean our community was very well represented. So we could hold people's feet to the fire as far as describing and letting them know how important it is to stop this stigma.
Yes.
So we'll see what happens.
Yes. Okay,
We'll see what happens.
I was looking on my phone. Yes, that's great. So so any of you guys out there that are newly diagnosed and you're diagnosed with Rett, you want to talk to Melissa, you want to join her group. She's doing wonderful things for those that have the biomarker Rett. You know, have any questions about clinical trials, she is the one you want to speak to. My goodness, she's been on 6, so she's very knowledgeable in that aspect. So you make sure you get a hold of her. If you know of someone that was just diagnosed with lung cancer and they're Rett, send them to Melissa. Find her on Facebook, find her group, or just reach out to me and I could connect you with her. It is very important for us to continue bringing awareness, to continue to educate, to continue to stop the stigma. Research matters, guys. Research matters. Trust me, it matters. You know, because of these clinical trials, if they start working, and then of course, you know, it goes into FDA approved and it becomes, you know, a targeted therapy or immunotherapy for some of us. So, you know, it's very important. So Melissa, now that you are NET, and now you have, I know you had hope the last 14 years, you had hope because you were still, after 14 years, going through that crazy journey of ours with lung cancer, but now you're NET. And you had hope then, and I know you have hope now. What gives you hope today after being told that you are NET?
I really don't live my life any differently than I have been, to tell you the truth, Juanita. Like I said, I stopped thinking, worrying, obsessing, having anxiety, all that long ago. Now, that's not to say I didn't have it, you know, initially.
Right.
It's only natural to go through those feelings when you're first diagnosed. But as the years went by, I got to the point where I don't worry about it anymore. Right now, it pleases me to give other people hope, just in the fact that you know, 14 years ago, I was given 3 to 5 years to live. So they were wrong.
Exactly.
And I wanted to say too, because of your show and just how we interact with each other at the conferences that we attend and all that, I think we learn so much from each other. And I think most of us, people that have been involved in this, like you and a lot of others, probably, this is a probably terrible thing to say, but know a lot more than some oncologists. Is that wrong to say?
No, it's not. It's not. We're entitled to our opinions. That's how I see it.
Well, because I've talked to people all over the country
Mm-hmm.
whose doctors don't think it's important to do biomarker testing.
Oh no. Oh
Well,
no.
no, but think about it. These oncologists in small communities that have to deal with people with all different kinds of cancer, and with how quickly research is developing,
Yes.
it would be hard for anyone, and I'm not knocking the doctors.
Right, right.
uh, it's hard to keep up with what's going on.
It is. That's why, like you said in the beginning, if you're diagnosed with lung cancer, seek a specialist.
Right, and I have a support group that I discovered that I
Awesome.
started that I started here, and one of my newer members, the couple, we were talking about comprehensive biomarker testing, and the next meeting they came to, they said they brought it up to their doctor, and their doctor said, these support groups are nice for support, but they don't really know what's going on with treatments and that kind of thing. And it's funny because I was talking to Chris Straff. She called me I guess that same day, and I told him about that because I was fired up. He said, "What's her name? What's her name?" He wanted to call. I
And
couldn't remember.
yeah, okay, so the support group is not, uh, the support group is not for us to go in and know of every research or treatment or whatever. The support group is for us to get together and support each other during our walk with, if it's lung cancer, colon cancer, whatever. Just like there's support groups for grieving moms that lost a child, just like
Right.
support groups for people that are alcoholics, the AA, drug addicts. They might have a separate support group for moms or parents that lost a child to suicide. I mean, it's there to support, to hear each other's story, to let whatever is on our chest out. That's what our cancer support groups are for. You're there and you're in charge of, let's say, the support group, and you have someone who's newly diagnosed and is sitting there crying, and you could see fear in her face and fear in her eyes and uncertainty, and she's just sitting there, or and hear everyone else. And then that's giving that individual, that person, well, if Melissa's okay and Betty next to her is okay and David over here is okay and they're talking and laughing, well, you know what? I think it's going to be okay. You're giving that one person hope. So yes, these support groups are to support each other and be there for each other and hear our stories and help us get through whatever it is that we're going through, not to know about, the next clinical trial or research or immunotherapy. No.
Right, but when we give these people a suggestion, ask your doctor why you're on this treatment. How did they determine you should have XYZ treatment?
Mm-hmm.
Because that's what I do. And when they went and asked their doctor, the doctor pretty much put the support group down, said that we don't know what we're talking about.
But then you could do it not hospital related, do it on your own. Everyone come meet at Starbucks, or everyone come meet at your house, and in exchange, it says, okay, well, if you do it weekly, say, okay, this week will be at my house, next week it'll be at Betty's house, the following week, and take turns and go to each other's homes. So you're in the comfort of someone's house in their living room with a cup of coffee or tea, whatever, snacks, just sitting around talking. It doesn't.
Right. Well, but I also like to do a little, well, I'm a teacher, I can't help it.
Yeah.
Education. And in this particular case, I just suggested that they ask their doctor about biomarker testing. And when they did, the doctor got a little mad.
I see. I don't understand why you're not. You guys, we know we're not the medical experts, but we have lung cancer and we live with it. So yes, we educate ourselves. So yeah, we're a little bit knowledgeable in that area.
Exactly.
You know what I'm saying?
Exactly.
So you're not giving Betty or David or, Karen over there any bad or wrong information. You're
Or medical information. I'm not
right,
giving any I just have
right,
them ask a question.
exactly. Questions that you will find um, in any lung cancer organizational site.
Exactly.
So you're giving them the same information that if they logged on to longevity or went to LCFA or Lung Cancer Research Fund or whatever, even American Cancer Association, whatever, they have questions to ask your doctor.
Well, I give everybody in my lung cancer support group a copy of Bonnie Adario's book. I don't know if you've ever seen it. So they can go by that and come up with their own questions.
So you're not giving them medical, you're
advice.
giving questions to ask their medical professional. Hey, what about this? What about that? What about that? But too, it could be that maybe that oncologist or that doctor might have not been knowledgeable of that.
That's what I'm saying. And it happens so often.
Yes. So that's good that you're telling them seek a lung cancer specialist. See,
if you can.
Yes, if you can seek even if you got to drive an hour away, do it. It's worth it.
Right.
Other people fly, from like, let's say if they live up in the Dakotas or Minnesota or something, a lot of them fly to Boston. If they're out positive, they'll fly to Boston to see Dr. Shaw. Yeah, or they'll fly to Denver to see Dr. Kamich. I mean, a lot of people do that. So don't be afraid. Where there's a will, there's a way,
And I do that too. I fly from Florida to New York City.
There you go, see?
But I want to throw this out here too, because this is one of my pet peeves, if you will. But as I said, this is my 6th clinical trial, and I've had to pretty much get myself to all the other ones, Boston or wherever. This clinical trial I'm on now, they make all my flight arrangements and pay for them. And they make my hotel reservations and pay for them and give me a loadable credit card to use for cabs and meals when I'm in New York. So all I do is show up at the airport. I tell everybody about this, including GlaxoSmithKline. I sit on their board of this one particular project, and I remind them of that all the time. Because these pharmaceutical companies, they need people. They need people to put on these trials, and they have the money. And we should not have to be responsible for our own expenses. And now that I'm not, I don't think I could ever go back. But
people, yes, if all other treatments ran out or are not working, please listen to Melissa. She knows. 14 years, my goodness. Try the clinical trials. Look, she did 6, and finally the last one worked. She has no evidence of disease. And don't worry about cost or anything. Like she said, they pay for everything. If you live in California and you got to fly to the other side of the world, trust me, they'll pay for it.
Well, this trial did.
I think other trials do too, if I'm not mistaken.
Not some.
Some? Really?
Not too many. Ask your audience if anybody else. I don't know.
Yeah. Any of you guys ever been on? You know what? I think, was it Barb or Alyssa? I don't think they're watching. But guys that are watching, any of you guys been on clinical trials? And if you did, was it paid for? Please let me know in the comments. I'm actually curious because Melissa is saying some they do pay. I thought they all paid, but
no.
Yeah, then I'm wrong. So please share with us if you were ever on clinical trial, if they paid or not. I'm just curious. I would think they should, but hey,
They should.
yeah,
Absolutely, they
I
should.
think I didn't know that. Well, thank you for letting me know, Melissa, because I just assumed, I thought they paid for everything. Wow.
Oh no, when I was going to
Yeah.
Boston, I had to go once every 3 months, and
Hmm.
it was all on my dime. The flight, the hotel.
Wow.
Yeah, yeah.
Okay, so then I'm wrong and you're right, and that's wrong because
Well, no.
they should pay. I'm sorry, but they should,
Well, yeah, they should.
of
They should,
course. But
absolutely should.
yeah, yeah. So, Melissa, what words of encouragement do you have for our viewers? It could be for anyone. It could be just something in general for all of us, or if you want to give words of encouragement to someone who is going through a trial, or someone who is was just newly diagnosed and is scared and has fear, in their hearts. What words of encouragement can you give them?
Well, I would say just never, never, never give up. Don't give in to despair. That's easy for me to say, um, but just try to take things a day at a time. Um, Stay off the internet for the most part,
Yeah.
unless, yeah, and unless there's a specific site, unless you go to a vetted place for your information, like
Mhm.
LCFA or longevity, or what the ones you
Go
Bonnie
to
Adario, and
foundation.
yeah, the Go-To Foundation, the legitimate ones, because there's
Mhm.
a lot of stuff out there you don't need to read.
Right. That's true.
Or reach out to one of us, somebody else
Mhm.
that has had lung cancer. That's what we're here for, to
Yes.
help each other. I'd be happy to talk to anybody anytime.
Yes.
And
And she's awesome. So reach out to her.
well,
Or the first time I met her was my first Hope Summit, right? 5 years ago. It's in 2015, I think, right, Melissa?
I think because I had been to the one before that too, so
Yeah, yeah. So my first one was
it all gets
2015.
fuzzy. But
I know.
I remember meeting you for sure.
Yeah, and we became Facebook friends, and we just in contact. So
Yeah,
but I have a great, they're all of you guys are my family, all the lung cancer community. I have one big family, and you got
yeah.
family, and so it's like we could be different parts in the United States, and it's like, it doesn't matter where you're from. It does
Mm-mm.
Nothing matters. We're just one big family. And
We are, and
yeah,
isn't it something that we all, we all, this all kind of started at our family feeling at the I still call it the Hope Summit,
yeah, me too.
uh, and it's like a family reunion every year. And think about it, Juanita. It, we keep seeing each other year
Yeah,
after
after year.
year after year, and that in and of itself is so encouraging.
Yes, it is. I look forward to the Hope Summit. I look forward
Oh yeah.
to see the people I've gotten close to. And even though there's many that I like see for a brief minute at the Hope Summit, hug them or whatever, and then, they go their way, I go my way. But even on Facebook, we like or comment or send each other messages.
Right.
And, you know, I know that I'm always posting, and I don't know everyone that has lung cancer. A lot of people know me. I know of them. And I'm always getting friend requests. And if you're lung cancer survivor or whatever, I'm going to accept you because that's just me.
I am too.
I'm going to
I
accept
have
you
more
now.
lung cancer friends
Yes.
than
Yes. So do I. Yes, so do I. But if it's some weird guy saying, "Hey, how are you? Good looking," no, then I delete. But and I know that you guys on my page, I'm always, I lost another one. I lost another one. And some of my friends are probably saying, "My goodness, how does she know all these people?" Trust me, I know all them people. If I didn't meet them, face to face is through Facebook. We've
Right.
on each other, we liked each other, we message each other. A lot of them we just message, and I haven't met them. Like Shauna, I don't think I've ever. I don't know if she went to the Hope Summit. I can't remember if I met her. Terry, I did, but I don't think I met. But I got close to her because she always tuned in every Thursday. She always liked. She always commented. I think she even shared. She asked questions, and so that's why I put. I'm gonna miss seeing, her name come across and asking.
Yeah.
And even though I didn't meet her, and I can't remember if I did, sorry, it's just I meet so many people, I still had a closeness with her. And so many of you guys won't understand that, me or Melissa. Melissa might know other people that I don't know, but she has closeness with them because we have that bond. And what bond us, unfortunately, was lung cancer. But I thank lung cancer because if it wasn't for lung cancer, I wouldn't have met Melissa and all these wonderful people out there that are my family, my lung cancer brothers and sisters. I don't care what race you are, what creed you are. I don't care if you live in New York all the way down to the southern Mississippi. Different parts of the world, political party, if you're a believer, non-believer, I don't care about that. We are bonded through lung cancer and we're a family, and I love them just as much as I love my friends that I talk to here at home. And
Amen.
that's something that many won't ever understand. But I hope you never go through what we've gone through. But we became a close knit group, family from all over. We support each other. If it's message, Facebook, it doesn't matter, Instagram, whatever, Twitter, all that stuff. We're there for each other. So, and we have that special bond. And
Yes,
absolutely.
absolutely.
Yes, I might not talk to Melissa every day, but God, if I'm going through something, I could just say, Melissa, call me. I got to talk. I'm just, she'll pick up the phone, and vice versa. That's just
right.
We have that bond.
And the first thing all of us do, and you touched on this earlier, when we get to the Hope Summit, is just hugs all the way around. And as you said earlier, you may only have, it's gotten so big over the years.
Yes.
The event has gotten so big that we don't have time to sit down and really catch up as much as we'd like to. So sometimes it's just, and that's why I plopped myself down on the bench that day, because you were sitting down there at the end of the hallway.
Oh yeah.
And I'm like, oh, there's Juanita. I may not see her again these next 3 days.
Yeah.
So
yeah, and that's how we do it. You run real quick, give them a hug, a kiss, or whatever, talk for a few minutes because it's gotten so big. I think the last one was over 400, and that was including caregivers. So it was 400. So can you?
Yeah.
Trying to see everyone. So we go for a quick hug, a quick hello, goodbye, whatever. And then, and we all have like our little groups that we kind of like, go with. And now that we have these groups, like she has the Red Renegades, I'm in the ALK Positive. Then you have the EGR Resistors, and then you have a new group started, the KRAS Kicker.
Something like ass kickers or something.
Yeah, something like that.
It alludes to ass kickers.
Yeah. And and I don't know what. So they kind of like say, hey, we're gonna, for dinner we're gonna go. Do you guys want to come? And then now we're split up with our groups. And then there's some there that don't have a mutation, so they get together. And then there's like 30 and under, I think. Like the young ones. They get together. Yeah. So we have like our little, and so we go our separate ways. When I started going in 2015, it was smaller, so we kind of like were able. Now it's just so big, but that's okay. That's okay. Usually, believe it or not, I go with Steve goes with me, so we kind of like, okay, it's just you and I. Let's go have a nice dinner somewhere. So we take off. So I really don't. And everyone's like, where's Juanita? Where's Steve? Oh, they went on their own. I'm sorry. And then we come back and we hang out. Everyone hangs out at the bar area. And then they buy. Yeah, that's the fun one right there. Oh, my goodness.
We can always find it because some certain tall person's always standing there.
Yeah, yeah. So it's great, and like I said, we do this once a year, and we know that when we leave, then when we come back, some will be missing, and we know that already. And in the beginning, I don't know about you, Melissa, but in the beginning, I was going back, and so wasn't going to be there anymore because they had crossed over. It was really taking a toll on me. I was really getting sad and depressed. But now I want to go because I want to go and see someone just in case. I want that last hug just in case. And do I cry? Oh yes, guys. I might have just met this person and one time and hung out with them like an hour or two at the summit and just bonded with them. And then throughout the years, see them on Facebook, talk and message, like and comment. And when they pass, believe it or not, I cry like a baby.
It's a member of the family that's gone.
Yes, yes. So I look forward to it, and I want to go because I want to see everybody, and I want to give that person, whoever God might call home, that one last hug.
Yes.
And my husband, I think my husband can really handle it because he really took it bad when a few had passed, and he got closer with some of the gals that I wasn't even that close with, and he got very close with them. And when they passed, he was more sad than I was, and I was like, wow,
Yeah.
like Ray Newt, him and Ray Newt did
Oh.
Yeah, they were always she was always commenting, always messaging. I mean, and when she passed, my husband took it hard. And I was like, wow. I mean, I was closer, but I wasn't that close. I mean, I took it hard. But see, when you get close, and I don't think he was able to handle it, Melissa, but I think now he's doing better.
You know what I think? I think that he, well, I could be wrong, but he associates that with, well, you know what, that could have been my wife.
I think so too. I do. I think so too. But I tell him, no, we got to stay positive, think positive.
Mm-hmm.
Believe in God's word, his promises, and I'm going to be okay. This is how I see. This is what I tell people. And I tell my husband, God is not going to call me home until I visit every country on this planet. I love to travel. So even if I'm 81 years old, I'm going to be on a plane, probably going to wherever I have to go, and said, okay, when I step the last piece of land on this beautiful creation of God, the earth, when I've seen every place I wanted to go to, every exotic island, I'm going to say, okay, Lord, I could go home now peacefully. I've seen it all. I see beautiful palm trees, beaches, beautiful, everything. You can always say that. So that's my goal.
Oh, well, there you go.
So
you're going to do it.
Yes, I am. Yes, I am. Yes, I am. But Melissa, okay, well, I have no questions. Unless I'm not getting them for some reason, I don't know with the way. Oh,
that's okay. Maybe
Yeah, we'll go. You can always go back to the video and see if there's any questions. I'm just, for some reason, they're not. If there are any, and if you guys did ask, I'm not seeing them, so I do apologize. But if you did ask questions, don't worry. Melissa will go. Once this is done, she'll go in there and look, and she'll answer them. She'll get in contact with you. So, but Melissa, thank you again so much.
Oh, you're welcome. Anytime.
Melissa's interview part 2. I thank you for story, sharing your wonderful news that you are no evidence of disease after 14 years, after 6 clinical trials. Finally, you found something that worked for you.
Yes.
I am very thankful to God, very grateful. And thank you for coming on last minute and sharing your amazing story. Keep sharing, keep advocating, keep fighting. So not only you and I, but our brothers and sisters and our newly diagnosed brothers and sisters could live a long and healthy life. And again, thank you so much for
you're welcome. God bless you, my sister.
Yes, thank you, honey. God bless you too. You have a good evening. Stay safe. Stay away from people. Don't go out if you don't have to.
Oh, I don't leave my house.
Yeah, me either. I've been cooped up in here for about a week now. I think I'm going crazy.
Yeah.
Thanks for watching.
Good night, everybody.
Yes, good night. Share this video. tag people that that this video would help them and bless them. And you know, again, if you know of someone, you know, they're read clinical trials, send them to Melissa. She is, I'll say, an expert in this because she's been through it all.
Well,
So thank you, Ganai. I love you. God bless you. And I will see you soon.
okay. Mwah.
Okay, bye. Bye. Bye, everybody. Have a good evening.